This brief video is on palpation of the bony structure of the pelvis in screening the pubic joint and sacroiliac joints. And there certainly is a lot of soft tissue that should also be palpated, and the palpation should be done in standing, but perhaps more importantly, it should also be done in prone and supine, because there can be some compensation in standing where what you see is not really what is actually happening. So I urge caution in terms of how we evaluate what is going on in standing, and if we find what we think is a significant asymmetry in standing, we need to find out the actual cause. Is that coming from the hip? Is it coming from the knee, the foot and ankle complex, etc.? And so, because I have a pelvic model here, I'm going to emphasize the palpation that's done in supine and in prone. So in terms of checking for relative symmetry, we find the PSISs, and we palpate on top of the, ASISs, anterior superior iliac spines. And we're looking at anterior and posterior positioning, and you can then slide your thumb underneath this and repeat looking for relative symmetry. Now you're looking for superior-inferior relationships. And then we palpate on this flat portion of the iliac crest, which I call the anterior iliac shelf. And you're looking for superior and inferior, and also anterior and posterior relationships. And there's a very nice thesis on evaluating the Hesch method of palpation and spring testing on the pelvis. And we use a few additional landmarks than the traditional model of palpation. It's not entirely different, but it shows good intratester reliability in the palpation, and also in the specific spring testing that we do to evaluate mobility through the pelvic joints. But anyway, coming down now to the pubic structure, you want to palpate the very, very top of it. So you want to make sure you can indent soft tissue, and then come down and palpate bone, and allow for the width of the symphyseal fibrocartilage. And for most people, it's only a couple of millimeters, 2 to 4 millimeters wide. But in a woman who's had children, then it may be wider than that. So I allow for a pinky width, my little finger width of the fibrocartilage, and palpate bone on both sides. And we're looking to see if there's any significant step off going from one side to the other. And then we palpate on front of the pubic bone, and there is this tubercle on both sides called the pubic tubercle, and you can palpate that on both sides. And traditional approaches such as muscle energy technique and others only evaluate the top and the pubic tubercle. In the Hesch method, we also palpate the middle aspect of the pubic bone, and we also palpate the lower aspect, and then we walk across onto the fibrocartilage and onto the other pubic bone. We do that several times. We repeat crossing over at the middle of the joint, and then we also do that at the superior margin. So we're gathering a few more data points. Now, when we have the person in prone, then we look for the PSISs, posterior superior iliac spine, which is the lower portion of the ilium, and we palpate both sides, and we're trying to appreciate relative anterior-posterior positioning. You can come underneath them and appreciate superior-inferior, but much more reliable is to actually come under the sit bone, under the ischial tuberosity, and compare sides for superior-inferior positioning. And they'll palpate not the crest out here, but rather this flat portion that's right in the middle of one hemipelvis, is this flat little portion of the ilium called what I name the posterior iliac shelf. And we palpate that and look for superior-inferior positioning. Now we do have access to palpating ligament, so you can come across that and dig deep, and you can access part of the iliolumbar ligaments. And then as you come inferior, you're palpating more of the sacroiliac ligaments. And as you come down below the Psis and on it, you're more on the long dorsal sacroiliac ligament and also sacrotuberous ligament, which is easily palpated down here between ischial tuberosity and the inferolateral angle of the sacrum. At that point, you can twang across like a guitar string, and once you isolate it, then you can indent it. Then you can come up vertically and isolate part of the sacrospinous ligament and indent that as well. We also want to palpate the flat portion of the ischial tuberosity, and there's a generous amount of it that is flat. And so you want to appreciate the position thereof. And we also want to palpate medial to the ischial tuberosities. And you're comparing that to the midline crease, the midline gluteal crease. Then you come underneath the sacrum and you appreciate the inferolateral angle, which of course is covered by ligament, and then you appreciate the coccyx. When I palpate the coccyx, I come from above on the sacrum and fold down onto it, and then I compare both sides of the sulcus to evaluate for possible side bending, malpositioning, and also try to gain an appreciation of the curvature of that structure. Sometimes you can palpate the very tip of it, other times it's just too far anteriorly. And then we come back to the sacrum. When you're at the Psis, you're at the level of the second sacral segment. Okay, so coming onto the sacrum, we're at S2, so come up about 1 thumb width, and then you're at S1. So you can palpate S1, S2, S3, S4, and S5. And of course you would also look at that in not only standing and in prone, but also in sitting with some flexion. And very important to screen the sacrum in sitting flexion. And then you can come up and then you're palpating L5. And this is the focused evaluation of the bony pelvis, excluding the hips. And we're not talking about muscular palpation at this time. We're primarily focusing on ligament and bone. And this is a thorough evaluation of the structure. Thank you very much.